So what should be documented by the practitioner about acquisition of consent?
I think when you discuss the issue of documentation of an informed consent of a patient, I think the first and foremost point to make is that it is not a one-off exercise. There's a common perception amongst healthcare professionals across the board that indeed it's just a question of getting a consent form signed. Nothing could be further from the truth. As the patient's condition changes, so will the terms and context of the patient's informed consent change too. So, for example, what should be documented in the patient records is the consent form I just mentioned. Now, in that instance, there should be space for the signature of the patient to acknowledge they've had the hazards and the level of risk of those hazards occurring, explain to them in full, as I referred to earlier on. And equally, there should be a space for the signature of the healthcare professional who's taking the informed consent. In the case of a vulnerable patient, for example, either an elderly patient who may have issues of mental capacity or a minor patient who's under the age of 16 years of age, there may need to be provision for a signature of their legal representative. But in addition to the consent form, there should also be a brief discussion in bullet point form of the nature of the discussion that was undertaken with the patient. This bullet point summary should again summarize the nature of the procedure, the type of hazards that will be raised in the acquisition normally of the informed consent of the patient by any healthcare professional for that procedure, and the level of risk of those hazards occurring in that instance. That should all be documented so that obviously for any healthcare professional they may see a number of patients on any one given day, and sometimes it may be difficult to remember what was said in the course of that consultation with the patient. It's not only a good aide-memoire for ongoing treatment of the patient, but in the event of any complaint or legal proceeding, it is also a good record by which the healthcare professional can refer to in the event of any such complaint.